Corns and calluses are common skin conditions that affect many people, particularly on their feet and hands. These conditions involve areas of thickened skin that develop as a protective response to repeated friction or pressure. While similar in nature, corns and calluses have distinct characteristics that set them apart. Calluses are broad, flat areas of thickened skin that usually develop on weight-bearing areas like the soles of the feet, the palms of the hands, or the knees. They often feel rough or bumpy to the touch and may appear yellowish or pale in color. Calluses serve a protective function, developing in areas that experience frequent friction or pressure. For instance, people who work with their hands a lot, such as musicians or manual laborers, often develop calluses on their palms. Similarly, runners might develop calluses on the soles of their feet. Corns, on the other hand, are small, concentrated areas of thickened skin that typically develop on non-weight-bearing parts of the feet, such as the tops or sides of toes. Unlike calluses, corns often have a hard center surrounded by inflamed skin. Causes of corns and calluses. Both corns and calluses develop as a result of the body's attempt to protect itself from friction and pressure. The exact causes can vary, but they generally involve repeated rubbing or pressure on a specific area of skin. For calluses, common causes include repeated friction from manual labor or playing musical instruments, walking barefoot regularly, wearing shoes without socks, or participating in sports or activities that put pressure on the hands or feet, such as lifting weights. Corns often develop due to ill-fitting shoes that are too tight or too loose, foot deformities like bunions or hammer toes, wearing high heels which put extra pressure on the toes, or abnormal gait, or foot mechanics that cause excess pressure on certain areas. Both corns and calluses can be exacerbated by certain foot conditions. For example, people with flat feet or high arches may be more prone to developing these skin thickenings because their foot shape can lead to uneven pressure distribution when walking or standing. Age can also play a role in the development of corns and calluses. As we get older, the fat pads on our feet naturally thin out, which can lead to increased pressure on certain areas of the foot, promoting the formation of corns and calluses. Certain medical conditions can increase the risk of developing corns and calluses as well. People with diabetes, for instance, often have reduced sensation in their feet, which can lead to unnoticed pressure or friction, resulting in callus formation. Similarly, conditions that affect the normal alignment of the bones in the feet, like rheumatoid arthritis, can lead to abnormal pressure points and subsequent corn or callus development. Symptoms of corns and calluses. The symptoms of corns and calluses can vary, but there are some common experiences. For calluses, you might notice a thick, rough area of skin that feels hard or raised to the touch. The skin may appear flaky or dry, and occasionally there might be pain or tenderness when pressure is applied. Corns often cause a small, round area of thickened skin that's painful when pressed directly. They may appear as a hardened, raised bump and can sometimes cause pain even when not directly pressed. Both corns and calluses can cause discomfort when walking or wearing shoes. However, corns tend to be more painful than calluses because they often develop in areas with less underlying fatty tissue to cushion them. In most cases, corns and calluses aren't serious health concerns, but they can cause significant discomfort and affect your quality of life. They might make it uncomfortable to walk or wear certain shoes, and in severe cases, they can even alter your gait as you try to avoid putting pressure on the affected areas. For people with certain health conditions, like diabetes, corns and calluses can be more serious. Diabetics often have reduced sensation in their feet, which means they might not notice if a corn or callus becomes irritated or develops an infection. This can lead to more serious foot problems if left untreated. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of corns and calluses. Diagnosing corns and calluses is usually straightforward. In most cases, a doctor can diagnose these conditions simply by looking at them and feeling them. They'll examine the affected area, noting the size, shape, and location of the thickened skin. Your doctor will likely ask about your medical history and lifestyle, including questions about your footwear, your daily activities, and any foot problems you've had in the past. This information can help them understand what might be causing your corns or calluses. In some cases, your doctor might want to rule out other conditions that can cause similar symptoms. For example, warts can sometimes be mistaken for corns. Your doctor might examine the affected area with a magnifying glass to look for the tiny blood vessels that are characteristic of warts. If your doctor suspects that an underlying foot deformity is contributing to your corns or calluses, they might recommend x-rays. These can show the bone structure of your foot and reveal issues like bunions or hammer toes. Treatment for corns and calluses. When it comes to treating corns and calluses, the first step is often addressing the underlying cause. This might mean changing your footwear or modifying activities that create excessive friction or pressure. For calluses, a common approach is to gently remove the thickened skin using a pumice stone or foot file. This process is most effective after soaking the affected area in warm water to soften the skin. Following the filing, applying a moisturizing lotion helps keep the skin soft and prevents cracking. Comfort is key in managing these conditions, so wearing well-fitting shoes is crucial. Many people find relief by using cushioned insoles or orthotic devices, which help redistribute pressure on the feet, reducing the likelihood of callus formation. Corn treatment follows a similar pattern, but with some specific differences. Corn pads can provide immediate relief by reducing pressure on the affected area. Shoes with a wider toe box are often recommended as they decrease pressure on the toes where corns commonly form. As with calluses, gently filing down the corn with a pumice stone can help, especially after softening the skin through soaking. In some cases, medicated corn pads containing salicylic acid may be used to help remove the corn, though these should be used with caution. It's important to note that individuals with diabetes or circulatory problems should avoid self-treatment of corns and calluses. The reduced sensation in their feet increases the risk of accidental injury, which could lead to serious complications. These individuals should always seek professional medical care for foot-related issues. For more stubborn cases, a podiatrist or dermatologist may recommend more intensive treatments. These could include professional removal of the thickened skin, which is done with specialized tools in a clinical setting. In some cases, custom orthotics might be prescribed. These devices are designed to correct foot mechanics and reduce pressure on problem areas, addressing the root cause of corn and callus formation. In rare and severe cases, particularly where an underlying bone structure issue is contributing to the problem, surgery might be considered as a last resort. While over-the-counter treatments can be effective, they must be used carefully. Products containing salicylic acid, for instance, can be powerful tools in removing corns and calluses. However, they carry the risk of damaging healthy skin if not used correctly. This risk is particularly high for people with diabetes or poor circulation, who should avoid these products entirely due to the potential for developing ulcers or infections. Prevention of corns and calluses. Prevention often proves to be the most effective strategy in managing corns and calluses. This starts with choosing appropriate footwear. Shoes should fit well, providing ample room for the toes and avoiding rubbing against the feet. For those who work with their hands, using protective coverings like gloves when handling tools can significantly reduce friction and callus formation. Maintaining skin moisture is another key preventive measure. Regularly moisturizing keeps the skin supple and less prone to thickening. This is particularly important for the feet, which often endure significant daily stress. For those prone to foot-related issues, using padded insoles can make a big difference. These insoles help distribute pressure more evenly across the feet, reducing the likelihood of developing pressure points that lead to corns or calluses. Similarly, always wearing socks with shoes provides an extra layer of protection against friction. While these preventive measures are generally effective, it's important to recognize when professional help is needed. Any corn or callus that becomes very painful, shows signs of infection, such as redness or swelling, or bleeds easily should be evaluated by a doctor. This is particularly crucial for individuals with diabetes, poor circulation, or weakened immune systems, as these conditions can complicate even minor foot issues. Now, we want to hear from you. Do you or someone you know have corns or calluses? What was the cause of it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.